Because of my history of being interested in doing reconstructive surgeries and coming to Washington, to an area, having come from Chicago, where no one had really been doing a lot of Peyronie's disease surgery and Peyronie's disease treatment, the concept of injections, which was invented in Chicago, is something that I embraced and brought in high volume to Washington, D.C. There are very few people that do Peyronie's operations. They are not things that we do every day, but I do count that amongst something that I do readily. Peyronie's disease is a very common problem, and it's a very stressful and psychologically complex problem. In general, most of the consultations that I do, and I do many for Peyronie's disease, are really just discussions of psychology more than anything else. Peyronie's disease is a scarring of the penis that occurs mostly mysteriously, but it tends to affect the ability for an erection to occur, and it usually causes curvature to the erection. It can cause pain in its initial phases, which almost always goes away, and then the patient is left with a change to their penis. My number one question is going to be, does that change actually affect the sexual act in any way? Because there's nothing to be done very easily for Peyronie's disease. I don't necessarily ascribe to the concept of taking nonspecific remedies. I do perform injections for Peyronie's disease commonly, and I do perform surgery for that. I'm one of the few people in town that does that. But I usually won't recommend those things unless it's truly causing an impairment in that patient's ability to perform the sexual act. Most patients with Peyronie's disease just want to make sure it's not likely to get worse, and it won't typically, that it's not likely to move on to what they might have been reading about on the internet in terms of a curved penis that's severe, which it typically will not. And I would say 90% of patients with Peyronie's disease are reassured by our visit. They move on. It's just their new normal. It's not that bad. And they simply become understanding that it's merely a slight change that doesn't need to have a big change in their actual life or psychological outlook.